Okay, this is part two of the integumentary system. So now we're going to look at the accessory structures. And the first accessory structure we're going to look at is hair. Hair follicles, sebaceous, and sweat glands and nails are all part of this. They are derived from the embryonic epidermis. They are located in the dermis, but but the hair can actually project to the skin surface through the epidermal layer. Hair will cover almost all of the body except the palms of the hands, sides of the fingers, sides and soles of the feet, sides of toes, lips, and portions of the external genitalia. The function of hair is to protect and insulate, to guard openings from particles and insects, and serves as sensory receptors. I just remember when I was in undergrad and I had an anatomy book and it said the function of hair is to notify you of insects crawling on your body. If you think about, take one of the hairs on your arm or hand and just try and move that one hair, you'll actually feel that and you'll be able to sense that. The hair follicles, these will extend deep into the dermis. What they do is they produce non-living hairs. Once a hair has sort of erupted from the surface of the skin, that portion that you're seeing is no longer living cells. They are essentially dead keratinized cells, much like the outer layers of the epidermis. They are wrapped in dense connective tissue. The base is surrounded by sensory nerves, which is referred to as the root hair plexus. And you may even have what are called erector pili muscles. These are smooth muscles. Because they are smooth muscle, they are involuntary, which means you do not have conscious control over their action. The contraction will cause the hairs to stand up and produce quote-unquote goosebumps. Regions of the hair, we have the hair root. This is the portion that will anchor it into the skin. And then the hair shaft, this is the upper part of the hair. And looking here, this would be the root right here, and then this would be the hair shaft coming out of the skin here. We can see we have sebaceous gland here. We'll talk about that in a second. That's going to help to keep the hair pliable and sort of coat it in this oily secretion. And then you also have the erector pili muscle. This is what can cause those goosebumps, quote unquote. When you look at a cross section of a hair follicle, you can just see that you have the medulla, which is the core. The cortex will surround that, and then you have the cuticle, and then you just have the outer cells, the external root sheath. These are just layers and layers of cells that just sort of build on top of each other. This is looking at an actual histological section, looking at the longitudinal axis of the hair follicles. And here's a cartoon version of that. So looking at the general structure of hair, the medulla is your central core. The cortex is the intermediate layer, and then we have our cuticle, which would be this layer that we find on the surface or outer layer. The internal root sheath, this will surround, these are layers that we typically find in the hair follicle. The internal root sheath will surround the hair root. The external root sheath, this will extend from the skin surface to the hair matrix. And then there's what we refer to as a glassy membrane. This glassy membrane will be a clear layer that is wrapped in connective tissue. And that's really for protection. So the production of hair begins at the hair bulb, which is found at the base of the hair follicle. And what you will have happen is you will see this actually surrounds the hair papillae, which is connective tissue that contains capillaries and nerves. That's going to be your supply. At the base of the hair bulb, the epithelial cells will form a layer known as the hair matrix. This will end up producing hair, and as cells divide, hair is pushed up and out of the skin. Hair will grow in cycles, and you will have continuous growth of hair, and then you will also have some hair that dies off or sheds. As hair grows, the root is firmly attached to the matrix of the follicle. When the follicle becomes inactive, growth will stop, and hair is now referred to as club hair. New hair growth cycle will begin. The follicle produces new hair. Club hair will then be shed. It'll just fall out. There are different types of hair. We have vellus hair. This is soft, fine hair that covers most body surfaces. This is a lot more prevalent in females than males. And then you have terminal hairs. This is heavy, pigmented hairs. We typically find this on your head, eyebrows, eyelashes, other parts of the body after puberty, underarms, groin area. And in males, the legs and arms will be more terminal hair, less vellus hair, less of that fine hair, more of that coarse hair. Hair color is produced by melanocytes at the hair matrix, and it's determined by your genetics. Gland secretions that we find in hairs, sebaceous glands, this is going to be oil glands. This is going to discharge a lipid secretion called sebum into the hair follicles. This will lubricate and protect the hair shaft. It will also inhibit the growth of bacteria. Sweat glands, these are apocrine or eccrine sweat glands. What happens is with the apocrine or eccrine sweat glands, the apocrine sweat glands are going to be found in the armpits, around the nipples and pubic region. They are actually going to produce more of a cloudy and stickier secretion. And sometimes with the apocrine sweat glands, you actually get sort of an odor from that. The eccrine or merocrine sweat glands, these are widely distributed, and this is really just secreting sweat, which is 99% water plus salts and solutes and things like that. Okay, other integumentary glands, we have mammary glands. Mammary glands will end up producing milk, and they are typically found just exclusively in the breast, especially in females. And then ceruminous glands, these are going to be found in the ear canal, and they will actually produce a modified secretion called cerumen, which is earwax. The control of the glands is mainly under the autonomic nervous system. Now, I know we haven't talked about the nervous system yet, but one of the divisions of the nervous system is referred to as the autonomic nervous system. You have no conscious control over, the mechanisms of this system. This is your involuntary response, okay? So the regulation of these secretions, you can't say, I want to sweat more. Now, you might be able to consciously do actions that would cause you to sweat more, but the actual response of sweating is because of mechanisms that have been triggered to allow that to occur. Okay, nails. Nails will protect the tips of fingers and toes. They are made up of dead cells packed with keratin. Now, the keratin that we find in nails is referred to as hard keratin. And it's going to be harder than the keratin that we find in hair. And that is even a little bit harder than the keratin we find in skin. Okay. Metabolic disorders can actually change nail structure. For example, pitted nails may result from psoriasis. Nails could also be an indication of malnutrition or protein deficits as far as coming in nutritionally. The structure of the nail, we have the nail body. This is the visible portion of the nail. This will cover the nail bed. You also have the sides of the nails. These lie in the lateral nail grooves. They're surrounded by the lateral nail folds. The skin beneath the distal free edge of the nail is referred to as the onyx or the nail. Nail production will occur in the epidermal fold called the nail root. This is the deepest part that lies very close to the bone. The visible nail will emerge from under part of the nail root, and this is known as the cuticle. Near the root, blood vessels are obscured, and this will actually produce what we refer to as a lunula or luna or moon-shaped. And if you look, you sort of have a crescent-shaped paled area just at the area where the nail bed emerges from the skin. All right, so here we have our nail body. Here's the lunula right here. And this is going to be the proximal nail fold and your lateral nail folds on either side. Looking at a cross-section of a nail, this looks very similar to that of hair. You essentially have many cells just sort of radiating out from a core, okay? This is going to be your bone here, this is your finger, and then you have your nail body right here, okay? Here you can see the nail is embedded right there and sort of comes up on the surface here. Okay, it's enough of hair and nails there. Repair to the integument. Repair to the integument following injury, such as bleeding, swelling, pain, will result if you have injury to the integument. Mast cells, when you damage tissue, you're going to sort of trigger an inflammatory response. This inflammatory response is essentially because those damaged cells are actually going to start releasing chemicals which will trigger certain immune cells to cause other cells to start to sort of amplify up the whole response. What will happen is you will form a scab, which is a dried blood clot. This will help to stabilize and protect the area. Macrophages will clean the area. The macrophages are phagocytic cells that will come along and essentially get rid of any debris that needs to be removed. So if you have a break in your skin here, you have these mast cells sort of revving up this whole immune response here. And the first stage that we're going to see is referred to as the inflammation stage. Then we have the migration stage or phase. This is after several hours, the scab will form. Cells of the stratum basale are migrating along the edges of the wound. Phagocytic cells are now actively working to remove any of the damaged tissue there. Sorry. The proliferation phase, this is about a week after injury. The scab has been undermined by the epidermal cells migrating over the collagen fiber and meshwork produced by the fibroblast proliferation. Phagocytic activity around the site has almost ended, and the fibrin clot is actually starting to break down. After several weeks, the scab will shed, and the epidermis is complete. A shallow depression marks the injury site, but the fibroblasts in the dermis continue to create scar tissue that will eventually sort of elevate that back up. And what you will have remain is this scar tissue with this fibrous tissue will remain underneath in that area. Repair the integument following an injury. The clot begins to dissolve. Number of capillaries decline. Non-cellular scar tissue is produced. And sometimes you may even have a keloid, which can sort of form. And, this is with bad scarring right here. You can see this keloid that is sort of formed there. Effects of aging on the skin. As I mentioned, the epidermis will start to thin out. The number of dendritic cells will decrease. Vitamin D3 production declines. It's very important as you age that you are supplementing these vitamins in, especially if you're also trying to supplement calcium in. Your melanocyte and glandular activities will start to decline. Blood supply to the dermis is reduced. And the function of the hair follicle will decline as well. The dermis will thin, the elastic fiber network will shrink, and then the repair rate will slow down. And this is just a summary of the functions of the integumentary system, great to sort of have those down on one little slide here. Okay. That is it for the integumentary system and the end of part 2 of this lecture. This is also it for exam 1. Oops. And, the next set of lectures, when we get into skeletal tissue, the skeleton, that will all be part of exam 2. So that will actually open up next week. Anything that you guys work on next week in the second module will not be on exam 1. It's just chapters 1 through 5. I hope everybody has a great weekend, and I look forward to seeing you all on Tuesday evening. Again, if you have any questions, please reach out. Thank you.